Hello, everyone. Welcome. Thank you for joining us. Speaking with Michael McGowan regarding Valley Hope. And I guess we'll start right off with how can veterans benefit from your program?
That's a very good question. Basically, with Valley Hope, we are a homegrown treatment center. We started in Norton, Kansas in 1967, and we now are in the Veterans Community Care Network. So veterans get referred into us, but it takes just a matter of hours to get that referral in. We come in, we take over. It's absolutely no charge to the veteran whatsoever. And the pure focus on them is to get recovery. We basically take over everything, payments, financials, all that stuff, and their main focus is just to get them the help they need and get them into recovery. Thing we really like to pride ourselves on is veterans take preference, veterans get priority, and we do not waitlist veterans. Even if one of our facilities is full, we will still make room for the veteran to get into that program. We are a nonprofit organization, so we very much take this to heart. We're in this for the long haul.
All right.
Wow. Awesome. And so if a veteran was listening and felt like, Valley Hope was something for them, where would they go to get more information or kind of start that?
Okay, so there's a couple ways. There is a website, valleyhope.org, that they can go to. If they want to go specifically to the veteran page, it is valleyhope.org. I believe it's /treatment/veterans, and that goes to the veteran program. There is another way. They can email me. My email is Michael McGowan, which is MichaelMcGowan @valleyhope.org. They can email me whenever, and I can meet them, talk to them on, reach out that way. We do have a phone number that is a 24/7 admissions number that they can reach out to them. That is 800-544-5101. Valley Hope is also on social media, LinkedIn, Instagram, I believe Twitter and Facebook.
Awesome. And those listening, we will be posting that information on all of our outlets where you can listen to or see our information. So we'll be an added resource for people to find you guys.
Yes, and I mean, sorry, I didn't mean to interrupt.
No, please go ahead.
Basically, the easiest way I would say would be either to look on valleyhope.org or email me, because I'm always responding. I can get wherever anyone needs to go to get them assistance, talk to them, reach out to resources in their area to kind of help guide them. That is my entire job, is basically to get out there, advocate, and work with the veterans to get them whatever they need.
So in that case, is it nationwide then? Like it's not really like a local?
It's 19 programs in 7 states. So we are in Colorado, Arizona, Texas, Oklahoma, Kansas, Missouri, and Nebraska.
Okay.
Awesome. Okay.
Go Midwest.
Mm-hmm. But we can take veterans from wherever, as long
that
as
was my question.
Oh,
yeah,
okay.
we can. I've had veterans come in from Wyoming, the Dakotas, Illinois. It doesn't matter, with wherever that veteran comes from. They're in the network. They're in the program. We can take care of them however we need to.
Okay, awesome. And so the overall goal, I mean, to a degree, it's obvious, but I'm sure there's some details. The overall goal of the program, where would you say the end is, or at least the kind of passing on point? Passing
Okay,
forward,
so
I should say. Not passing
so one of the
passing forward.
One of the things I like to tell people is, with Valley Hope and our program, when you're done with us, we're still not done with you, because we are going to be with you for the rest of your life. How it kind of goes is, if they go in patient treatment, they can go anywhere from 28 to 45 days inpatient. Then we do intensive outpatient, which is up to 35 weeks of outpatient. And then from there, while they're doing outpatient, we have this alumni program. So when you graduate the inpatient, you become an alumni. We have a group that meets, texts, calls each other. My counterpart that we just hired in Colorado and I are working on an app that we're going to go live with. That's an offshoot of the alumni group that we use, which is Chess. And it's an app that actually will connect all of our graduates and our alumni all over the state. And it'll be, you can call, text, let's say somebody's having a bad day in Arizona, someone in Nebraska can jump on and see that. Or if someone's traveling, they can reach out to wherever they're going and reach those vets. But basically, from once they leave the program, we're always going to be looking out for them. They do get-togethers where it's nice out, they'll go play golf or go bowling or whatever. But basically, we're building a sober community, just letting them know that, yes, you're sober, but you still got a strong community around you. We're always going to be by your side. We're always going to have your back. So when some groups are done, basically, I like to put it up to the fact that when we got out of the military, it was basically like, good luck, have a nice life. Where with us, it's not like that. It's good luck, but we're not going anywhere. Before they leave the program, because we've got case managers and counselors with them, they set up with whatever groups are going to be near their town. Our alumni will reach out and set up sponsors if they need it, and reach out to the sponsor and connect them, so the sponsor can kind of help them get into whatever groups they need. So that, and then we have like peer support that are now starting in some of our areas. So yeah, basically, the second they are led into our program and start, we're with them for as long as their journey takes them. We've had individuals that may have sadly relapsed. They come back, pick them right up where they left off, and support them the whole way. I really go ahead. I'm sorry.
I was going to say, I really like that maintaining a support network, because that's something we talked about in our interview with Monkey Brain Art, and I'm sure we talked about it with another.
Oh, those guys are great.
Yeah. And but we were talking about how, like, in the military, you form your camaraderie because everybody has to be in formation. Everybody has to be there, and then everybody has to be in the motor pool. Everybody has to go on this rock march. So you're forced, kind of like school, like you're forced to be with these other people. And so like, oh, here's who's here, and here's what I'm going to bond with, and we're going through this together. And then when you get out of the military, you don't really have that. Like, kind of had a job, like everyone's got their lives. So, I mean, I'm kind of guilty of this. Like at 5, like, I'm leaving. I've got kids at home. Like, I'm gonna go, and I've got a podcast, and like I got stuff to do. And so, you're not like, there's not this like this. You just don't have the same camaraderie. And so whenever there's a program like Monkey Brain Art or Valley Hope, where it's kind of like it maintains a sense of community that you otherwise wouldn't have. That's really an important thing that I think some people know is important, and other people I think overlook it, or they just never even think about it.
Right. And you're absolutely right. And that's another thing that we're working on too. So I've actually reached out to Monkey Brain, and we're going to meet so we can kind of do a veterans group with them. There's a equine therapy group that I know, Horses and Heroes, and they're ran by former Marines. I talk to them a lot and reach out to them, and they're more than willing to, do a group out there with just the horses and our veterans group. So we're just basically ensuring that there is always going to be a sober veteran community supporting each other.
That's awesome. I really like the idea of that app too. That'll really help when people are just in that quick, need help right now.
Absolutely. Yeah, we're really excited for that one to kick off. We've been really working on it, and we're just kind of going to piggyback off of the alumni group that already has it. And we're just going to build a veteran group that's specific to us. And like I said, it's just guys will be reaching out. We'll just kind of do check-ins, just basically, a sounding board and texting back and forth, whatever everybody needs. So
awesome.
And then do you have any success stories from veterans that maybe you'd like to share or anything like that?
I do actually. So what I do is whenever a veteran gets into one of the facilities in our area, Boonville, Atchison, or Moundridge, I go and check in with them, kind of meet with them and talk in with them, and just let them know, that I've got that I'm here. And I've had them reach out to me and say, thank goodness that, we've got you guys, because we're not cookie cutter. We're not hospital. They don't like that very like stringent hospital kind of, almost, some of them even said like prison kind of look. And it's just, it's not like that at all. We're very low speed, meet you where you're at, kind of just help guide you on the way. And they really like the fact that there's people there that care. There's people that listen. They're not being just talked at, a lot of, like, there's a gentleman that I just met with that's still in there, and He was struggling because he's relapsed a few times, but he's being very patient because of the fact that he's like, people are just here and listening to me, like, the nurses and all the counselors just love our veterans, like they just love it. So whenever they see one, they just jump onto them. So I've really heard a lot of the guys that when they get out, they just like that fact that they feel like they're a human again, and then they've been treated like a human, and it's very understandable.
Yeah. It's it's amazing what just listening will do. Or my wife and I talk about it. Basically, like having the conversation up front of when one of us has, usually it's her telling me something because it's kind of a man versus woman thing, but it's like, sorry, honey, do I need to listen or am I going to help you solve the problem? And usually, oftentimes it's like, just listen, listen, be supportive. And that's what like a lot of people want. And so it's good that that's feedback that they're getting is just supporting a person by listening and then just kind of waiting for them to take the next move or make the next move.
You don't always have to fix it.
Yeah. I'm kind of a fixer. I'm guilty.
That's all right too. Yeah.
There was actually a gentleman that I met. He was a veteran and he went through Valley Hope 6 years ago. And he actually now works in the nonprofit sector for a veterans group doing substance what's it called? He does like meetings for like substance recovery. So he's trying to build like little substance recovery groups in the nonprofit that he works for. And he swears by it. He said, if I hadn't gone through this program at Valley Hope just because of the way it was, I don't know where I would be. And he's like, and I'm going on 6 years now. So, I mean, I've met people that are now in this field because of what they went through here.
Excellent.
Wow.
And you were telling me one time that a lot of it, the sense of community is a big piece of it because and you were saying that's why Alcoholics Anonymous is supported because you have people understanding the struggle and then not to like totally separate, but like veterans, it is different depending, versus that everyday citizen. And so even more so, you got not only veterans that have kind of seen or to some degree what you've seen, but they are also going through the same struggles. And so you kind of have like double down on what people have in common and how they can support each other.
Yeah. Because the hardest. Oh, sorry.
No, I was just saying, and just to kind of like, I tend to jump back and forth. I apologize, but just to kind of talk about the alumni stuff is, we have guys that are out there and doing stuff, and they do the AAs and the NAs, and yes, we have meetings, but we definitely let people know that we're not doing like an NA meeting. When they do meetings with us, it's just checking in, hanging out, and being with your buddies. Whether it's going like we do summer barbecues and like fishing trips. So we want to make sure that they work so hard at their jobs. They work so hard on their sobriety. They're always going to meetings and groups that when they're with us, it's just, okay, let's just kick back and enjoy our company. So I do definitely want to let people know that once they're in the alumni program, we're not throwing meetings at them. It's when they get together with us, we're just hanging out as a group of friends, basically.
Awesome.
Yeah.
So then for advice for a veteran or service member that's kind of first reaching out to the program, or even they've reached out and now they're starting, what is some advice you would have for them, either to get more out of it or certain ways to look at it if they're feeling apprehensive, those kinds of things?
So a big thing that seems to come up is the stigma of it's a sign of weakness if you go to ask for help or anything.
Right.
We definitely like to push that. No, when you actually get to that point where you're seeking treatment, that is showing how strong you truly are. That is a very strong person to say, yes, I need assistance. So we like to let them know to just be patient. You're safe. You're not alone. It just we're here now. Like, don't be afraid to ask for help. I guess that's like the biggest thing is you're safe now. You're not alone. Be patient. There is always going to be somebody there. We have people there 24/7 for inpatient, and then for like outpatient, we've got the counselors and the peer support. Our head counselor at Overland Parks is a former Marine. He's in recovery. So, I mean, we've even got people that are working for Valley Hope now that are in recovery, that have been through the program. So everyone really takes that to heart. So we just want everyone that thinks about it to just let us know. Like we'll take care of you. We know what you're going through. We don't know specifically what you're going
Right.
through, but we know you're going through something tough. So we've got you. Like just don't be afraid to ask, and you are strong. You can do it.
Awesome. Building on that, are there any examples you ever give or have to give out where you say like consider it like this? Because I mean, for some people, it is so hard, and when
Mhm.
we say simply like, well, just be strong, and you are strong, and you are strong to get help, and for some people, it's
Okay.
not enough. So just out of
Right.
curiosity, do you
Yeah.
do you run into some people where you kind of frame it differently, or
I guess kind of like the best way to put it is when you first get in there, it's going to be a lot, especially if they're going through detoxes. We do detox them there. So that can get rough. But once they actually start getting into the groups and everything, they're even the patients that are there, whether they're veterans or not, they're very tight knit. They will hold you accountable. So if somebody's screwing up, they're going to jump on them, and you're not screwing up my sobriety, But at the same time, we do these small groups where every day the same small group of patients meet for a couple hours every day, and it's just them, and they'll go through like how they're thinking, how they're feeling. They will get called out by other patients if like they're struggling with something or they're not opening up to something, like they're being held accountable. I actually had a guy that was in there that was in for 21 days, and he's like, I'm doing fine, I'll be good, like I got this. And the whole group was like, no, stay, just stay, just stay, hang in there for another week, and afterwards when he left, he was like, wow, thank you, I'm so glad I did that. So it's hard work, but they're not just like throwing stuff down their throat. They're teaching you how to think for yourself again, how to live for yourself again. Basically, yeah, they do all kinds of different classes and groups and everything. Like they're always working, doing class work and business work and everything, just basically trying to teach them how to live again as a sober person. And what another thing that I think is really cool is we do this, it's called a coffee cup ceremony. So when the person is in there, they get a coffee cup and they can paint it and draw on it and do whatever they need. So when they graduate from the program, they hang it on the wall. And then at their first year, we do a ceremony, and they come back and they basically get their coffee cup and they come home and they can take it home with them. And once a month, we actually do that at every facility, every month on a Friday. I believe it's like the third Friday. Alumni and graduates will come back to the facility, and we do a day of like just hanging out, barbecuing, talking. They do ceremonies. They celebrate every person's, whether it's 1 year or 20-year sobriety, they do a ceremony for them. So I really like that. I mean, it just makes everyone feel so much better to know that they're a person, that they have a purpose in life. Like people care. So yeah, it's with every person it's different. I always try to let them know that I'm here, especially with the veterans, because like we know our guard goes up if you're not a vet, that kind of thing. So I always let them know that, you know what, I struggle too. I've been sober now 3 years, I'm a vet too. It's a struggle, it's an everyday thing, but you're not alone. Like just ask. Like I'm always here. Somebody is always here. So just if you have an issue, don't hesitate to reach out. Like we're not going anywhere. You're not in trouble. I hope this is answering the question. I tend to
yeah,
kind of like
this
go
is
off on
excellent
tangents
information.
and
No,
Oh,
stuff.
this is
yeah.
excellent. Tangent away.
Yeah.
Tangent away.
Mhm. And to let them know, like, just because you're asking for help isn't a bad thing. It's a disease. It's not a sign of weakness. It's not a problem. It's a disease. And whether it's cancer or alcoholism or substance use, it can be fixed. Like we can help you work through that. Like I said, you're not alone. We're not in it for the money, and we will find help for you. We've had individuals that, maybe it didn't work at Valley Hope. So we're not going to just turn our back on them. We actually go out there and find another group that will hopefully assist them better than we would. So there's all these businesses out there and everything, but when it comes down to it, the bottom line is we are just there to help veterans get better. So if it works for us, great. If it doesn't, let's find something that does work. So I wish I could kind of give better advice. It's just kind of that best thing. It's just I sit with them and just, all right, let me know what you're thinking. Let me know what you're feeling. What do you need? How can we help? So yeah.
So something I was thinking about too was because like I would assume one of the hardest things after like going through like the inpatient is like going back to like the environment that you came from. You know what I mean? Like because going back to an environment where people are like, hey, come drink, or hey, come do what you normally always did. Like but then you come back and you're like, no, like I'm sober. Is there any like advice that you guys really give for, or I'm just kind of curious because I bet that's one of the hardest things to go back to is like that environment.
That is hard. We've seen instances where people will actually, when they get out, they will not go back to that same town. Well, they'll move or something like that. The other thing we do is like I said, we've got the alumni group. So if you're feeling anything, ask them, text, call, reach out, email, something. Just throw it out there, whether you're thinking it or not. If something's not sitting right, just let somebody know, because somewhere there is somebody there that will help you, that's got your back and can reach out. So it's just like, I mean, I hate to say like, just have faith in it, but it is that. It's like, if something's not sitting right, reach out, because there is somebody there that will help you, whether it's talking with you, meeting you for coffee, or whatever it is. But it is hard. And I always I like people that know that are new to sobriety is they say, watch out for the pink clouds. So when you get out, that first month, you're like, I got this, gung ho, boom, boom, boom. You're going to have ups and downs. That happens. It's just the way it is. So expect it. But just remember that, if you start to slip, somebody's got your back.
So for Valley Hope, do you guys have a kind of a family oriented portion to it? Since you do all this work for the individual themselves, what about support for the family?
So we actually do take care of the family as well. We feel that is a huge aspect that needs to be involved. They'll do family groups when they're with the counselors or something. They'll set up meetings where the family will come in. They'll do one-on-ones with them. They'll help educate the family as to what more about education of the addiction, what may be happening, what to expect. And just kind of help get them started moving forward as well, so they can kind of start to heal that family dynamic and bring them together. So it's not just that one guy works on something, but he can't heal with the family. We try to heal with the family and educate the family as well, because for everything like that to work, I mean, no matter what it is, whether it's the military or anything, the whole family needs to be a part of that. With our life, I feel like when it comes to like trauma and everything, it's really good for the family to know what the signs are, how to react to certain things. It just helps to kind of help educate them, and I think it helps bring that family closer to know that they are actively involved in assisting this person in their recovery.
Okay, awesome.
Yeah, I love that.
Yeah, and I mean, I imagine people are pretty responsive with that.
They really, it seems to be a really good sign. When the family actually starts to be like, oh wow, I can be a part of this, like I can learn with this, or that you can kind of help answer my questions, because if the person's in there getting treatment, they might not know what the family may be seeing or thinking. So it really does seem to help the family, and it brings that stress level down, and I think it just helps to strengthen that bond with that family.
That's awesome. Yeah, I'm sure that helps a lot, just knowing you have that community. Wow.
Well, yeah, I guess the biggest thing I just like to push about the whole thing is it's not cookie cutter. We don't go by like a set thing. Like I said, we've got people there 24/7. We've got doctors on site. We've got what they call medication assisted therapy, so you don't have to worry about medication. There's somebody there to help you with that. But we try to actually, when we get to working with people and they start to get into the recovery a little bit better, if something happens where they don't need a medication anymore, they'll start to draw them off it, so they're not so not attached, but so they don't need it as bad, I guess is the best way to put it. But yeah, I mean,
not so dependent on it.
Right. Yes. Thank you. That was what I was trying to get across. But it's we do like I said, counselors are there. Every person has their own counselor. Every person has their own case manager. Every person actually has their own chaplain. We do 12-step, but we don't push spirituality. We meet them where they're at, whether it's God, Buddha, Allah, or whatever, or it's just nature itself. Like that's whatever you need for that higher power, that's your higher power. That's what we're going to help you with. Case managers will help set you up for if you need an assistance looking for a place or someone to reach out to for employment or anything. Like we want to set it up so when that time is up, it's a warm handoff to the next person. And I mean, and I still like, again, I love to push the individuals that are there working. Like the dedication is just incredible. Like they care so hard. And if someone doesn't, they don't last long. Because it's just, like I said, we're not in it for the money. It's in it to just help people, because the whole reason this company started is because it was actually a doctor and a priest had a farmer friend that could not stop drinking. And there was no place for him in the middle of Kansas. So they found a place, got him up there. And while he was up there getting treatment, they started to figure out some sort of program, and Valley Hope was born because of that.
That's
so
cool.
I really like to push that. It's, that's how it started. It was a priest and a doctor. We're like, you know what, my buddy's struggling. We need to figure something out. So yeah, it's just, I push that community, that family, that tight knit, and we're committed to getting them the help that they need.
Humble beginnings, it sounds like. That's cool.
Yeah.
Yes.
Wow.
That commitment to helping a friend and then helping everybody.
Yeah.
Really good.
We thank you for listening, and we hope you got something helpful out of this.
Right now, the best way to support us is to simply spread the word. If you know a fellow veteran who could use some resources to elevate their life, send them our way.
Until next time, remember to check your 0s, 5s, 10s, and 25s.